My name is Christine Kamau, a clinical psychologist at Crossway Psychological and Psychometric Institute, and today in partnership with Ponea Health, we will be talking about postpartum depression. In very rare occurrences, some women might experience what you call hallucinations and delusions. This is whereby they start hearing things that are not there or seeing things that nobody else can see. Now, this is referred to as postpartum psychosis, and it's another form of a serious mood disorder that a mother could get following childbirth. So what brings about postnatal depression? Now, postnatal depression is caused by a combination of factors, and some of these risk factors or causes include hormones. Following childbirth is a decline or drop in hormones, which could bring about the mood swings. Another factor that can bring about postnatal depression is if you've had a history with depression. For example, you've previously had depression years back. So following childbirth, you stand a higher risk of getting postnatal depression. Also, if there's a family history of depression or mental illness within your family, you're at a higher risk of getting postnatal depression. The challenges that come with caring for a new baby is another factor that could bring about postnatal depression. There's the financial aspect of it, there's the time consuming of it, or perhaps there's that baby who is consistently crying and you don't know what to do. That could also cause about or bring about postnatal depression. Financial constraints and other life events could also bring about postnatal depression. There is also support. If you're a new mother and you lack adequate support, that could cause you a lot of pressure leading to postnatal depression. Also the environment, perhaps wherever you are, the home context, there's a lot of conflict, you're not getting along with your partner, that could go a long way in bringing about postnatal depression as well. And lastly, if you're a first-time mother, or maybe perhaps you've had a challenging pregnancy, or you have had a baby who has special needs, that could also put you at risk or pose a risk for you getting postnatal depression. Another risk factor is if you have a prior experience with depression before. This could put you at risk of going on to get postnatal depression following the birth of your child. Also, if there's a family history of depression, say your mother or along the lineage, your grandmother ever had depression, it also puts you at risk of getting postnatal depression. Life challenges, for instance, you're having financial difficulties or this conflict at home, that could also pose as a risk of postnatal depression. I'm glad you could join us in this discussion. You can book my services through ponea.com. We look forward to you engaging with us in the next episode.